Ladies and gentlemen, as we are about to begin, I have a few housekeeping rules to make before we start the program. First of all, to all panelists and moderator, please switch on your camera all the time during your session. Please also be reminded to mute yourself if you are not presenting or speaking to avoid any sound disturbance. Secondly, to all attendees, I would like to seek your kind cooperation to use the Q&A box to pose any questions to the panelists and avoid using the chat box during the Q&A session. For our viewers at YouTube Live, you can post your questions in the YouTube chat section. The organizer will deliver the question to the moderator accordingly. Thank you, and we will begin shortly.
Science plays a vital role for economic development and societal well-being. Understanding this, the Academy of Sciences Malaysia was established with a mission to be Malaysia's thought leader in all areas of science, technology, and innovation. To realize its mission, ASM harnesses the nation's top scientific minds to chart the STI direction and facilitates the implementation of an innovation-led economy for the country. ASM's commitment lies firmly in fostering a culture of excellence in STI in Malaysia. ASM does this by providing independent, credible, relevant, and timely STI input of national and international importance to the country. Our network of expertise comprises Malaysian scientists, engineers, and technologists who specialize in various disciplines. The Academy assists in upgrading the nation's technological capabilities in the industrial sectors by producing high-quality publications, such as peer-reviewed journals, monographs, and books. In addition, ASM also provides input on current and future technology trends to be considered and taken up by the government in driving the nation's economy forward. To provide Malaysian scientists with the best opportunities and exposure, ASM actively extends its international networks and collaborations. It currently has a range of multilateral engagements with renowned scientific institutions worldwide. The Academy also champions the need to grow the right talent in STI by cultivating interests in science, technology, engineering, and mathematics to the younger generation. In short, the Academy's ethos is broadly defined as Think Science, Celebrate Technology, Inspire Innovation. Science plays a vital role for economic development and societal well-being. Understanding this, the Academy of Sciences Malaysia was established with a mission to be Malaysia's thought leader in all areas of science, technology, and innovation. To realize its mission, ASM harnesses the nation's top scientific minds to chart the STI direction and facilitates the implementation of an innovation-led economy for the country. ASM's commitment lies firmly in fostering a culture of excellence in STI in Malaysia. ASM does this by providing independent, credible, relevant, and timely STI input of national and international importance to the country. Our network of expertise comprises Malaysian scientists, engineers, and technologists who specialize in various disciplines. The Academy assists in upgrading the nation's technological capabilities in the industrial sectors by producing high-quality publications, such as peer-reviewed journals, monographs, and books. In addition, ASM also provides input on current and future technology trends to be considered and taken up by the government in driving the nation's economy forward. To provide Malaysian scientists with the best opportunities and exposure, ASM actively extends its international networks and collaborations. It currently has a range of multilateral engagements with renowned scientific institutions worldwide. The Academy also champions the need to grow the right talent in STI by cultivating interest in science, technology, engineering, and mathematics to the younger generation. In short, the Academy's ethos is broadly defined as Think Science, Celebrate Technology, Inspire Innovation.
Assalamualaikum warahmatullahi wabarakatuh, and a very good day to everyone from Kuala Lumpur, Malaysia, where we are broadcasting today. On behalf of the Academy of Sciences Malaysia, I would like to welcome each and every one of you to the AASSA webinar on tackling adverse effects of climate change on health in the Asian region. I'm Hazman Al-Hafiz Azam, your MC, also the bread to your sandwich, which I'm going to be at the start and at the very end, also the good part between in the middle. Thank you so much for being here. I would like to take this moment to thank our partners, the Association of Academies and Societies of Sciences in Asia, or in short, AASSA, and the InterAcademy Partnership, IAP, for making this webinar a possible event. As you might already know, at the end of the panel discussion, there will be a Q&A session, so please take this chance to engage with our esteemed panelists during the session. Leave your questions short and sweet as possible at the Q&A box for Zoom. As for those streaming from our YouTube, you may leave your question in the chat section. Without further ado, I would like to pass the floor to Professor Yu Han Kim, the immediate past president of AASSA, to deliver his welcoming remarks. Prof. Kim, the floor is yours. Professor Yu Han Kim? I think he's still not here. Maybe we can just proceed with the next session, which is the findings of the AASSA report. I would like to invite Professor Dr. Victor Ho Chiwai Abdullah.
Thank you very much, Mr. Hasman, for the kind introduction. So let me begin by introducing you to the reports that we have actually is already published on the IAP website and also AASSA website. So good afternoon, everybody. And today we are going to talk about the imperative of climate change to promote and protect health in Asia and Oceania. This report Hi, good afternoon. I'm Professor Dr. Victor Ho from the Department of Social and Palliative Medicine, Faculty of Medicine, University of Malaysia, a member of the working group. Let me share with you the background of this report of my presentation. The information that I'm going to share presentation is based on the imperative action. Sorry. Let me start again. Can you hear me, Hasman? Can you see my slide?
Yes, we can hear you
yes.
and see your slide.
All right. Today, I'm going to share with you the findings from the work carried out by the Association of the Academies of Societies in Asia and the imperative action to promote and protect health in Asia and Oceania. Good afternoon. I'm Professor Dr. Victor Ho from the Department of Social and Preventive Medicine, Faculty of Medicine, University of Malaya, a member of the working group for this report. Just to share with you a little bit background, that this information that I'm going to share with the presentation is based on the findings of the Imperative Climate Action to Promote Health report. This report is the work of the Association of Academy of Society of Sciences in Asia and is part of the IAP project on climate change and health, which is funded by the German government. The report is the work of 15 national academies from 7 regions in Asia and Oceania. From East Asia, we have the academies in China, Japan, and Korea. From West Asia, we have academies in Armenia and Azerbaijan. From South Asia, we have academies from Bangladesh, India, Nepal, and Pakistan. From Southeast Asia, we have academies from Indonesia and Malaysia. From North Asia, we have the Russian Far East. From Middle East Asia, we have Turkey. And from Oceania, we have Australia and the New Zealand academies. The Asia and the Oceania region is the largest regions in the world, stretching from Turkey in the west to Japan in the east, and from Russia Federation in the north to the New Zealand in the southern hemisphere. It's the most diverse climate variation from desert to lush forests. From the highest mountain in the world to the lowest depth of the ocean. It's also one of the most vulnerable regions to the effect of climate change. This is because the region has the highest population, 4.6 billion, which accounts for 60% of the world's population. It has countries with the highest population density, from 9 people per square meter in Russia to 1,265 people per square meter in Bangladesh. Has some of the longest stretches of coastal area, which is prone to flooding and rising sea levels. The region's urbanization ranged from 21% in Nepal to 92% in Japan of its people living in cities. Topping it up, many of the countries in the region is still largely dependent on agriculture-based economies. The region is also disaster prone from extreme weather events, and due to the large number of people and high population density, a large number of people have been affected by natural disaster over the last decades. Since 2000, more than 1.2 billion people in the region have been exposed to hydrometeorological hazards. There were more than 1,200 disaster events happening during this period, which accounts for the global human exposure of 91% of tropical cyclones, 92% of floods, and 66% of landslide on per head basis. From 1970 to 2011, more than 2 million people have been killed because of natural disaster, which accounts for 75% of the global fatalities. The risk of people exposed to flooding in the living cyclone-prone are doubled from 1970 to 2010. More than 60 million people are exposed to flooding risk, and more than 120 million people are residing in cyclone-prone areas. In the following few slides, we will describe the model on how greenhouse gases may lead to adverse radioactive forces that leads to global warming. Global warming will lead to environmental impact and lead to environmental modification, which later leads to environment impact. It's causing multiple environmental events, from increased sea levels, causing both increase and decrease in precipitation, and leads to extreme weather. The modification of the environment will cause negative environmental impact, which leads to negative health impacts. The model is an example of how greenhouse gases may affect human health. The major health effect of climate change includes vector-borne diseases, infectious diseases, flood and infectious diseases, malnutrition, particularly undernutrition and stunting, air pollution and cardiovascular, fire, long-term impact of human infertility and forced migration, mental health issue has been observed in different extent among countries in this region. There's also a problem of direct and indirect related effect. Direct health effect of health includes heat illnesses, exacerbation of pre-existing health condition, and increased hospitalization. The direct effect of heat includes heat rash, heat cramps, heat syncope, heat exhaustion, heat stroke, and ultimately death. Heat can also exacerbate pre-existing respiratory and cardiac condition. The effect of heat does not only depend on the absolute temperature, but also on the relative changes in temperature. In New Zealand, condition where temperature is above 25 degrees is considered hazardous and lead to increased heat-related morbidity and mortality. It can also cause indirect health effect on pre-existing medical conditions such as cardiovascular disease, respiratory condition, mental health, and diabetes. People with pre-existing medical condition may be more prone to develop heat exhaustion and heat stroke. With more and more people moving from the rural areas to live in cities, urban heat island will become a problem in the future. For example, in Australia, 90% of its population that is living in urban areas will be affected by heat. The heat vulnerable index for Australia is also in a high and upward trend. An increase of 1.5 to 2 degrees C will lead to more than 27,000 heat-related deaths, and annually of it, 822 million urban inhabitants in China. Heat also can cause indirect health effect, which increase ambulances calls out for slower response time due to heat stress, increase in hospital admission, increase in accidents, for example, drowning, work-related accidents, injuries and poisoning, increase in transmission of food and water-borne diseases, and bloom in marine algae, potential destruction of power, water, transport, and decrease in productivity. Heat not only affect the population, but also increase heat also affect outdoor workers like agriculture, forestry, and fishery, leading to heat stroke and decreased productivity. Besides heat, cold events can occur due to effect of climate change and pollution. Smog formation from human activities was attributed to the increase in cold weathers in Nepal, with 58 locations affected in 2010. Bangladesh also have seen severe cold events in the past 2 decades. And in China, cold-related mortalities outnumber the heat-related mortalities by 20 times. Forest and bushfire can lead to forest and bushfire can occur naturally due to prolonged dry days and reduced precipitation and high temperature. It can also occur due to human activities of biomass burning for agricultural activities. It is a recurring issue in many countries in the region, including Australia, Armenia, Azerbaijan, Indonesia, India, China, Malaysia, New Zealand, Singapore, and Turkey. Fine particles from fires is also hazardous to health and can travel very far, even across seas. The fine particles from fire in Australia has been found across the Tasman Sea to New Zealand. Similarly, fires in Sumatra and Indonesia has crossed the Strait of Malacca to Singapore and Malaysia. There has been increasing forest fire and more people affected by fires. Here are some of the examples from China, India, Turkey, and the Russian Federation. Forest and bushfire releases sulfur dioxide, nitrogen oxide, ozone, carbon monoxide, and total suspended solids in the form of particulate matters, PM10 and PM2.5. It can affect cardiovascular, respiratory, and psychological health for susceptible individuals. Climate change and flooding. Flooding is a major issue in countries in this region. Global warming leads to excessive precipitation and increased sea level. Excessive melting of Himalayan glacier leads to flooding in Nepal, India, and Pakistan, and Bangladesh and Bhutan. The Ganga originates from the lake of Manasaoa in the Himalayas. More than 400 million people live in this river basin. In China, half of the people and 2/3 of the land falls under the heavy threats to floods. In the last 30 years, the frequency and severity of extreme floods have increased. In New Zealand, Armenia, and Russia also see the similar issues of flooding due to climate change. Flooding leads to human health issue. In China, infectious diarrhea diseases increased by 4.8% during flood years. Flood in Solomon in the 2014 led to nationwide outbreak of diarrhea diseases caused by rotavirus. Outbreaks of diarrhea diseases from cholera, rotavirus, and leptospirosis following floods in India and Bangladesh. Floods due to cyclone also caused displacement, leading to sanitary and hygiene issue. In Australia, flood led to increase in dengue and leptospirosis. In New Zealand, flooding in 2017 and 2015 led to the dispersion of toxic chemicals, dam houses, and mental health issue. In China, acute CVD death among women in flood years were higher than in non-flood years. These are some of the health issues that related to flood. Now we come to the infectious disease, the threat and climate change. The threat of change in the temperature and precipitation increase and decrease of precipitation and humidity leads to the profound impact on life cycles and growth of infectious agents and their vectors. It can lead to impact on access to clean water, increase in polluted water, can also increase the threats of infectious disease due to the lack of safe water. The diagram summarizes the effect of changes in climate, extreme weather events, and the indirect effect of some of the pathway for infectious disease threat. Changes in the baseline climate can lead to cycles of vectors and pathogen, expansion of geographical distribution disease. Changes in extreme event can lead to cycle of vectors and pathogen as exposure of geographical distribution, which indirectly leads to population displacement, poor nutrition, and damage to health care infrastructure. Infectious disease can cause by waterborne diseases, foodborne diseases, and also vector-borne diseases. Food and vector-borne, here are some issues faced by countries in this region. Pakistan has the highest incidence of typhoid fever in South Asia. In Nepal, the outbreak of food and waterborne diseases is becoming more common. The risk will increase with the increase in the temperature and the rainfall. In India, the issue is in the lack of access to clean water, which is further worsened by the depletion of groundwater due to drought. The changes in the temperature has led to the change in the exposure to pathogen microorganisms as shown in Korea and Japan. Next, we come to vector-borne diseases. Some of the vector includes mosquito, ticks, sandflies, and fleas. The changes in temperature has led to the emerging and re-emerging of vector-borne diseases in areas and countries where previously it was not an issue. In many of the temperate countries, the Aedes mosquito are now present in their environment. Climate change will lead to higher risk of food insecurity and malnutrition. Studies have shown that the elevation of carbon dioxide levels can impact on nutrient concentration in food, which can lower iron, zinc, and protein levels in plant-based food. Many of the countries in this region still depend mainly on plant-based food as their staple diet. Rising sea levels, rising sea surface temperature also correlates with the microorganism and biotoxin levels in seafood. It also increases the rate of methyl mercury formation. In countries where seafood is consumed widely, like Japan and New Zealand, this will become an issue, especially during the hot summer months. Malnutrition anemia is a major health threat to both developing and developing countries. In developing countries, chronic malnutrition can lead to stunting, wasting, and underweight. Stunting is a problem in South Asia, particularly in Nepal, India, and Pakistan. The diagram shows some of the effect of global warming on agriculture. It can lead to loss of fertile coastal land caused by rising sea levels, loss of biodiversity, increase in adverse weather event leading to more unpredictable farming conditions, and increased incidence of pest and vector-borne diseases affecting plants and livestock. Effect of air, water, and soil pollution with environmental toxicants directly from human activities or indirectly for effect of climate change can also lead to adverse health effect. In a study in Malaysia, researchers have found that climate change influences the female fertility. The diagram explains the multiple routes for changes in the female fertility from air pollution, El Nino, temperature, heavy rainfall, sea level, food, altered hormone, and also allergy and other factors which can lead to climate change in female fertility. Now we look at the adaptation and mitigation option. Previously, we have just shown that what is the climate change and health effect. Moving on to the adaptation and mitigation option. The Asian Oceania region needs an integrated mitigation adaptation strategy tailored to its own needs to combat the effect of climate change on human health, society, and environment after implementation of international agreement. Developing countries, especially those in South Asia, are facing difficulties in implementing mitigation and adaptation plans for several reasons compared with developing countries. Several case studies are presented to show the implementation of the plan in various countries. National Adaptation Plan for Climate Change and Health. The idea is to accumulate scientific data and knowledge on climate change to fill the evidence gap, to increase evidence-based research and studies of capacity related to climate change and health, to identify the most pressing health threats from climate change, to provide scientific information, meteorological and medical and geographical warnings and alerts for prevention and adaptation by cooperating with relevant ministries and agencies, to raise awareness among general public, policymakers and healthcare providers, in addition to promoting effect by companies and local governments, to provide structural surveillance, monitoring and reporting system, to strengthen the capacity of healthcare system, including health preparedness and response to cope with the health effect of climate change, and to reinforce the health preparedness and response at the national, state, and district level. We provide an overview of adaptation and mitigation initiative for climate change with human activities. The mitigation includes reducing greenhouse gas emission, enhancing greenhouse gas sinks, long-term focus on avoiding future impact, global scale cross-sectoral effect needs to be effective, local and subnational nesting and collaborative needed. We also need to reduce vulnerability of enhancing adaptive capacity, start with focus on current variability, large-scale cross-sectorial effect needs to be effective, and sub-national global collaboration needed. These are the overview of the adaptation or mitigation for climate change with human health. General point for effective adaptation and mitigation: the importance of communication across different sectors, to develop and pilot early warning system for heat wave and health risk factors, research and studies on prevention and control of climate change and related diseases, enhance of health and care system, social transformation to help promote awareness and control and to improve water quality, sanitation and hygiene levels, development of technologies for adaptation and optimization of agriculture sector. There are co-benefits of mitigation from transport changes, electric cars, active transportation, and public transportation. From house and energy consumption, changes reduces greenhouse gas emission and reduce pollution. Encourage healthy lifestyle, active transportation reduces both greenhouse gas and improve health. Improve housing, reduces heating and cooling costs, and also reduces greenhouse gas emission. Dietary and food system, changes dietary to more plant-based, reduces greenhouse gases, agriculture and forestry benefit, and also technological transfer. from developed to developing countries. There are a few case studies presented in the report. One of them is Klang Valley Mass Transit System and also prevention of intrusion of the Caspian Sea, which I'm not going to describe due to the limitation of time. We're going to continue with co-benefit from action of agriculture and food system, exploring roles of community forests, reduce ethanol production and fuel substitution, and climate smart village in Havana. Common challenges in Asia and Oceania. Finally, we are going to, then after that, we're going to discuss about the conclusion and also recommendation. Common challenges include low public awareness, insufficient research, inadequate data and limited access to data, limited healthcare facilities and resources, insufficient financial economic support, impact of high financial and disease burden, especially on the poor. Conclusion. Climate change is happening on a wide regional scale and escalating. Climate change effect on health through multiple pathways. Identify regional variation and impact solution and science-based evidence and avenues for regional cooperation for mitigation is necessary. Identify new research area, increase in transdisciplinary intersectoral information sharing on the outlook of public health issues associated with climate change should be encouraged. Accumulate and use of evidence on health impact of climate change for reports emphasize that basis of coherent health policy development for climate change mitigation and adaptation strategies. Increase the responsiveness of health impact on climate change, as well as in promoting action that improve health while reducing greenhouse gas emission. Clarity of public health issues associated with climate change that should be addressed through multilateral collaboration. And highlight the common needs for national planning. Dealing with new and emerging health issues in Asia and Oceania in the face of climate change and a common solution. One size fits all may not solve complex problems faced by people in different social, economic, and political systems. Recommendation is to improve education and training, to increase research and knowledge and implementation, to integrate healthcare facilities, services, and implementation, to improve government support in policy development, and to improve financial aid and adequate resources to ensure that the future of humankind is safe from climate change that's currently happening. Thank you very much.
All right. Thank you so much, Prof. Victor, for the very insightful and interesting facts from the AASSA report. Now I'd like to invite the immediate past president of AASSA, Professor Yu Han Kim, to deliver his welcoming remarks.
Hello, this time, can you hear my voice?
Yes.
Okay, thank you. I'm sorry to have caused some technical trouble to you. Okay. This project was originally, first page. Okay, this project was originally initiated by the EASAC, European Academy of Sciences Advisory Council in November 2016, and through some steps, they finally published their report in June 2019. You can see the front cover of the EASAC's report. Then the German National Academy of Sciences Leopoldina secured funding and support from the German Federal Ministry of Education and Research, and the IAP decided to extend this project to other continents as well. And they chose AASSA for Asia and Oceania region, and IANAS for North and South Americas, and NASAC for Africa. And the leaders of this project is from the IAP, Professor Volker Tomoilen, co-chair of the IAP, co-president of the IAP, and Professor Andy Haynes, co-chair of this project, and Dr. Robin Fierce and Dr. Claudia Canales. And from the AASSA's part, I was in full charge of this project, but I asked Professor Khairul Anwar bin Abdullah, then President-elect of the AASSA, to take charge of the preparation of this report, because by profession, he's a medical doctor, so he must know much more than myself on this project. And then this IAP's Climate Change and Health Project was approved by the IAP Executive Committee in April 2019, and they called a kickoff meeting on 3rd to 5th of November 2019. It was held in German National Academy of Sciences Leopoldina in Halle, Germany, and the participants were representatives from IAP, AASSA, EASAC, IANAS, NASAC, and IPCC. And the AASSA's participants was myself and Professor Khairul Anwar bin Abdullah and Professor Ho Kim of Korea. And the major decisions made at the kickoff meeting was scope and design of the project, common template to be followed by the regional affiliates of the IAP, and roadmap and timetable and budget. Then on the AASSA's part, the general administrative and financial management was entrusted to the AASSA Secretariat and also the Korean Academy. And the preparation of the report was entrusted to the Academy of Sciences Malaysia, and project leader, as I mentioned before, was Professor Khairul Anwar bin Abdullah. And I assembled a working group as indicated in the table. In the East Asia, especially China and Korea, Professor Peng Gong and Ho Kim was originally recommended by the IAP, I think by Professor Haynes. And then I asked the Global Young Academy to recommend some experts, young experts to this project, and I received 3 nominations, but one nominee was not, I think, in full grasp of this project, so I excluded her, and I chose Dr. Shabana Han and Dr. Meghnad Dimar from India and Nepal, respectively. And then I asked each member of member academies of AASSA to nominate their own national representative, and I assembled 15 national representatives, and also in view of the importance of this project in the Pacific Island region, I asked Professor Colin, the screen is too far from me, so I cannot read it. But anyway, upon the recommendation of Australia and New Zealand Academy, okay, and I asked some other non-member countries of Asia, for example, Cambodia and other countries, and they actually agreed to send the nominees to me, and also they nominated several representatives, but they didn't send their manuscript. Okay, so unhappily, I couldn't include those countries in our report. Okay, and then we had down page, and then we held first working group meeting. It was an in-person meeting held 24th and 25th of February 2020, held in Kuala Lumpur, Malaysia. We were very fortunate because we had held this meeting just before the total lockdown was imposed by many countries. For example, when I came back to Korea after this meeting, about 5 days later, Koreans were not allowed to go to the foreign countries. Okay. So at that in-person meeting, we had occasion to discuss the total framework of this report and also the templates and also the timetables, etc. So the main frame of this work was already determined at this meeting. And then we held 2 more meetings these times in virtual space on 17th of June and also the 8th of October. So the major event was in July 2020, we signed the service contract between Leopoldina and CAST, because Leopoldina was the host academy of the whole project, and they managed the funding from the German Ministry of Science. And then we first completed the first draft in January 2021, and we've completed final draft in June. And in July for August, we sent the final draft to the peer reviewers. And then also after the peer reviewers review, we asked endorsement from the AASSA member academies, and we finalized our report as the official publication of the AASSA. And after the editing by the IAP in October 2021, we finally published the AASSA's report. The front cover of this report is, as you see this on this screen, and it closely resembles the front cover of the EASAC, because in final form, EASAC, AASSA, IANAS, and NASAC's reports will be coordinated and also edited into one global version. So to maintain the uniformity, we chose the similar design for the front cover. Okay. This is the main points of how we carried out this project by AASSA. And in closing, I would like to thank all the participants in the project, the working group members, national representatives, peer reviewers, and also the supporting staff of AASSA, CAST, Malaysian Academy of Science, InterAcademy Partnerships, Leopoldina for their dedication, time, and effort. Finally, I would like to express my profound gratitude to the late Professor Khairul Anwar bin Abdullah, and pray to the God, most gracious and most Almighty God, to grant eternal peace to his soul. Thank you very much.
Thank you so much, Prof. Kim, for the wonderful speech. And now, to get to know everyone better, we have prepared a sweet and short poll for you. Okay, let's begin. By now, you should be able to see the poll flashing on your screen, right? You may choose the best answer that describes you and press the submit button. And we will give you around 30 seconds, and it starts now.
Asman, the photo session.
Yep, we'll be moving to the last session.
Not now, is it?
Yeah. All right. Have 10 seconds left. 9, 8, 7, 6, 5, 4, 3, 2, 1. Right? Okay, I can see here there's a lot of us coming from the public health researcher, and following from the representative of governmental institution, and we have some of us from the industry representative and also from the NGO. We have a lot from scientists, and most of us coming from Southeast Asia, and then coming next from South Asia. All right, that's great. Thank you so much for participating in the poll. Now, let we move forward to our next agenda. I would like to invite Professor Dr. Jamal Hisham Hashim to moderate our panel discussion. Before we begin, I would like to make a few brief introduction of Prof. Jamal. So Prof. Jamal is actually an honorary professor of environmental health at University Selangor and the managing director of Prevenune Corporation. He was formerly a research fellow at the United Nations University International Institute for Global Health, currently chairs the thematic working group of environmental health experts under National Environmental Health Action Plan. Now, the virtual floor is yours, Prof. Can you please unmute yourself, Prof?
Yeah.
Right.
Thank you very much, Mr. Hasman. And Assalamualaikum and good afternoon to all my fellow panelists as well as fellow participants of this very timely webinar on climate change and health in Asia. As most of you are probably aware, climate change is the single biggest threat, human health threat facing humanity. We are talking about impact related to more frequent and severe extreme weather events, like hurricane, typhoon, tropical storm, floods, landslide, heat wave, and drought. And there is also the threat of rising sea level due to the melting of polar ice and the thermal expansion of our ocean. And Asia is one region of the world that is against this impact from climate change. Now, today we are very fortunate to have with us as panelists 4 very distinguished scientists as well as practitioners in public health and climate change. And we will have initial presentation from each of them, a 5-minute presentation. So I would like to remind all our panelists to please help to keep to the allocated time. And we will then follow with a discussion. I will present a few questions, but we will also try to entertain question and comment from the audience. So please pen down your comment and question in the question and answer so that we can present it to our panelists. Okay, let us now begin. Let me call upon our first panelist, which is Professor Dr. Robin Fierce. He is the Scientific Project Coordinator and Biosciences Program Director of the European Academy's Science Advisory Council. Professor Robin Fierce has had 29 years of experience in R&D in the UK pharmaceutical industry, focusing on cardiovascular diseases and neurosciences. While in the industry, he served on various committees advising trade association, the UK government, research councils, and academia. He was an honorary senior fellow at the School of Public Policy, University College London. So the floor is yours. Over to you, Professor Robin Fierce.
Thank you very much, Jamal. If I may show my screen to you all. Okay, quite sure. Can you all see that? Sure.
Yes.
Okay, let me start by thanking you very much for inviting me. And as you've already heard from Professor Ho, in his excellent and comprehensive presentation on the AASSA region. This project is part of a larger global project organised by the InterAcademy Partnership, which is a global network of more than 140 academies of science, engineering and medicine. And as you already also heard from Professor Kim, the report, the European report from EASAC has already been published, and reports from the Americas and Africa will be published for the next month or so. And also, in addition to the regional reports, they each provide the resource for a global report, which will be published in April. I thank all of the, I join in thanking all of the AASSA working group for their tremendous endeavours in the Asia Pacific region. And I also take this opportunity to remember our colleague Khairul Abdullah for his great commitment in leadership, in ensuring that the AASSA working group and report have been a great success. And I know that we all share sadness in his passing. In my next slide, let me just again remind you of the distribution of the 4 regional networks in Asia, Europe, Americas, and Africa. Together, they've provided an inclusive transdisciplinary approach to documenting the problems and identifying challenges and solutions, and indeed capturing the diversity, the exposure to hazards, health systems, capabilities, and the use of science to inform development. One point I want to emphasize just from showing this map is that the worldwide membership of IAP, it enables IAP to speak on behalf of those, for example, from lower and middle income countries whose voice is not always heard when designing research and developing policy.
Excuse
as
me,
I
Robin.
mentioned, the European report, yeah.
Excuse me, Robin.
Sorry?
Maybe you can click on the slide view to make your slide
Yeah, it doesn't work when I do that.
Okay. Okay, go ahead. Yeah.
I don't know, Hasman, can you put it onto slide view for me?
Yeah, sometimes that happens. Yeah, it's okay if you.
For some reason, when I click on slideshow, it doesn't do anything.
Yeah, that's okay. Yeah, no, don't worry about it.
Okay, let me just say that I think all of the regional reports, in their analysis, identify some of the common problems associated with heat and flooding, direct problems of climate impacts, or indirect, for example, caused by disruption of ecosystems, or increasing threats from infectious disease, or to food, nutrition, and security, as Professor Ho outlined. And I think recent advances in the science of attribution enable us to better connect the impacts to climate change effects. I have time only to mention one example from our European work on,
yeah, it works.
Okay, next slide. I seem to have lost the ability to control it now. Okay. Next slide, please. Okay, well, could you go on to the next slide, please? Okay. So as I say, I can only go previous slide now. Okay, thank you. Yeah, so this is a map of Europe showing the effect of the multiple effects of climate change on agriculture. It is a complex pattern. It's discussed in detail in our European report. The net effect is and will be declining crop yields of cereals, fruit and vegetables, with negative impacts on human health, even in Europe. But of course, there are interregional implications arising from trade and Europe seeking to compensate for declining productivity in Europe by importing from elsewhere. In terms of solutions, the goal, of course, is to develop climate resilient agriculture, and at the same time, reduce the contribution that agriculture itself related to greenhouse gases. Okay, next slide, please. The IAP global project, as you've heard, is ambitious in trying to capture diversity from around the world in terms of the 4 regional groups. We realized, as Professor Kim has outlined in our kickoff meeting, that we need to have a common starting point in order to develop the work of the regional activities. These were the questions that we all tried to address in our working groups, and you've heard how successful the AASSA working group has been in doing this, and you'll hear more during the course of the next hour in terms of the detail on some of these individual points. Of course, other groups around the world are asking similar questions, and I think the IPCC report number 2 will be published today. Our focus is particularly on solutions and focusing on those who are most vulnerable. Let me go on to the last slide in the interest of the time. Right. Yeah, okay, the last slide. So the work does not finish, of course, with the publication of our regional or global reports. Academies of Science and Medicine must continue to work actively to inform innovation, policy, and practice, as well as lead activities within the scientific community for new research. And we see the role for the academies as being very important, both at the national level in your own countries, engaging with policymakers and other stakeholders at a regional level, and the design of a project encourages this to come together at a regional level to take account of diversity and engage with regional offices, for example, at the FAO or WHO or UNEP, but globally also to engage with intergovernmental bodies and collectively to represent the voice of science to policymakers and other stakeholders, and in doing that, to represent the voices from around the world, including those who are not always heard. So I'll finish there, but look forward to participating in our general discussion. Thank you.
Thank you very much, Professor Fierce. Yeah, one thing about climate change is that it is a global impact. Yeah? And this call for a global effort, and certainly one thing that we should do is learn from each other. And I think people in Asia and some developing countries can learn a lot, yeah, from your experience in Europe, especially on the impact of climate change on agriculture, as you pointed out, and extreme weather event. So this gives a better learning curve, you know, for people who are just experiencing the impact now. Okay, let us move on to our second panelist, who is Dr. Shabana Han. She is the director of the Indian Research Academy in New Delhi. She is an alumna of the Global Young Academy and a World Social Science Fellow of the International Social Science Council. She has held academic and research position at the University of Delhi, the New Zealand Climate Change Research Institute, and the National Institute of Water and Atmospheric Sciences in New Zealand. The current research focuses on climate change, risk communication, and disaster response. So the floor is yours, Dr. Shabana.
Yeah, thank you so much, Professor Smile. And of course, I would like to start by thanking Academy of Malaysia for organizing such this event. It's really, need of the time. And I also want to thank AASSA, IAP, and GYA for giving me the opportunity to work on this very important, project. So I was given 2 questions, so I would like to address the answers. I haven't prepared the slide because it was just 5 minutes. So one of the questions that I received was, like, India is having a huge population and it is economically quite diverse. So what are the challenges and strategies that the country can adopt to protect its population. So I would like to start by saying that both the population, of course, we have a huge population and diversified economy, and they do pose various challenges, but they are also the strength of the country. So, and that is a very reason why, like, despite having so many disasters and so much of loss, even after COVID, you see the country bouncing back very faster. So these points actually also add to the resilience of the country. And definitely India has a huge population, and so the impact of any setback or any disaster is quite huge on the country as well. So if we look into the graph of what happened during COVID, the COVID graph of Asia almost reflect what happened to India, because India has a huge population that almost represent, part of what happens in the continent as well. So, but the challenge in India doesn't only or purely come from its large population. In some ways, India is a microcosm of Asia, not just in terms of population, but also in terms of geographically, it is quite diverse, economically diverse, socio-culturally, we are quite diverse. And so what does that lead to is one solution, if it is proposed at any level, it doesn't apply to all parts of the country. And there are several inequalities that exist in different ways that affect, like, that doesn't make any one solution to be either applicable or acceptable to the entire country. So that becomes a major challenge, but that doesn't mean there is not a solution, because I think the challenge, both problem and solution, emerge together. So what is our challenge is also the solution. So the best strategy in case of India is like making people more aware and prepared for what is happening due to climate change and its impact on health. At the national level, if we see the national policy, definitely they are looking into some integration, how climate change is affecting health at different levels. But the local awareness about the health impact of climate change is fairly less. Right, it is still at a nascent stage, and where now in India we can see several impacts of, or initial impacts of climate change happening, but climate change itself is evolving, and I think there is a need for further work, how a country can prepare and population can prepare for these kinds of impact. Another question I got was what role NGOs or civil societies can play or are doing actually. So just like a population, we also have a huge civil society, large number of civil society organization and NGOs. And according to ADB data, we have about more than 1.5 million NGOs existing in the country, which is quite huge, and which is definitely an advantage as well. But many of the NGOs are doing the same thing. So many times it dissolves their effectiveness, and some services become redundant as well. But I think there is a huge scope that how civil society can contribute effectively in dealing with health challenges and even climate change impact in the country. But then, of course, more integration is required at the national level, because if we look into the classification of these civil society organization and NGO, almost 20% are dealing with education, 7% are religious NGOs, and only 7% are looking into the health aspect. So I think if these civil society organizations can come together, there is a huge potential that the gap that we see in terms of public awareness or in terms of what people can do to deal with climate change impact and health issues, I think it can be better managed. So I think I've already covered 5 minutes. So thank you so much. And I hope it made sense.
Yeah, thank you very much for the wonderful insight from India. And I think India is certainly a very interesting country, which is diversity in economy and the social structure. And wow, you have 1.5 million NGO. That's certainly a force to reckon with. And I think this is where the NGO comes in, because I think climate change require extensive public participation. We cannot do it without the public. Okay. Thank you very much. We will come back to you later. Now I would like to introduce a very dear friend of mine, which whom I have worked with before. He is Professor Dr. Anthony Capon. He is currently the Director of Monash Sustainable Development Institute and Chair of Planetary Health at Monash University, Australia. Previously, Professor Capon was the Director of the United Nations University International Institute for Global Health in Kuala Lumpur, where I also work. So he's my former boss. Prior to that, he has held a professorial appointment at the University of Sydney and the Australian National University. He is a member of the Rockefeller Foundation, Lancet Commission on Planetary Health, very interesting concept, and the International Advisory Board, and is a member of the International Advisory Board for the Lancet Planetary Health. Please welcome Professor Anthony Capon, and nice to see you again, Tony. Over to you.
Thanks very much, Jamal, and terrific to be with you all today. I'm on Wurundjeri country here in Melbourne, Australia, and I acknowledge Wurundjeri elders, past, present, and future. And we may discuss this later, but Indigenous perspectives on climate change and health are increasingly important in our responses to these big challenges. So I'd like to just make a few reflections again for just 5 minutes from an Australian perspective. And I want to start with some images from the 2019-2020 bushfires here in Australia. Here, a picture of people sheltering on a beach, endeavouring to escape the heat and the smoke from the fires. And of course, this is what we saw all around the world, across Asia and in Europe, around the world. This is etched on people's memories 2 years ago, not long before we started grappling with the pandemic. So those fires in Australia in our summer of 2019-2020 burned more than 30 million hectares of land. Now, to put that into some perspective, that's much more than the size of the whole of the country of England. The fires led directly to the deaths of 34 Australian people, and notably, more than 3 billion animals died in that one season of devastating fires. Here, some data from the Medical Journal of Australia on the estimated health burden attributable to bushfire smoke in 4 states of Australia: Queensland, New South Wales, the ACT, and Victoria. And it's worth looking at on the far right-hand side. So excess deaths from any cause, more than 400. Hospital admissions, cardiovascular, more than 1,100. Hospital admissions, respiratory, more than 2,000. Emergency department attendances from asthma, more than 1,300. Now, these are very conservative estimates from Australia in the context of those fires. And as has already been mentioned in this webinar, mental health, I saw it in the chat box. Mental health is enormously important, and we're yet to fully account for the mental health consequences of those fires. We need to think more about mental health in the context of climate change more generally. Now, to bring it right into this week here in Australia, I've got this image from the floods in Eastern Australia, in southeast Queensland and northern New South Wales. In some parts of Eastern Australia, these floods are the most devastating since 1898. So well over one in a century floods that we're seeing just this week. Another image from that region in Australia. More than 7 people have already died in those floods associated with a really quite extraordinary La Nina event in our country. So as I finish, I just want to say a few words about the importance of science in our response to climate change and health impacts, and some of the partnership work we've been doing in Australia with the Medical Journal of Australia to really engage health professionals across the country. Australia was the first country to do a nationally downscaled countdown in association with the Lancet Countdown on health and climate change. We did our first report in 2017, and you can see there our title was Australian Policy in Action is Already Threatening Lives in Our Country. Then our 2019 report, a turbulent year with mixed progress. In 2020, the lessons from what is called the Black Summer in Australia, those devastating bushfires, and our most recent report, our 2021 report late last year, Australia increasingly out on a limb. And I guess that's the message to leave you with, that in this annual countdown process, we are tracking health impacts of climate change in Australia. We're also looking at policy responses, adaptation and mitigation responses, as Prof. Victor was referring to in his earlier presentation. And the frank reality is that Australia is not yet doing enough to act on climate change. Back to you, Jamal. Thank you.
Thank you very much, Tony. Yeah, I think you brought a very important point of tracking the health impact of climate change, because we are not looking 1 or 2 years ahead, but decades in the future. And it's very important, because if we don't keep track of the impact, we might just as well lose track of the impact. And it's sad to hear the extreme event happening in Australia. Not only to human, but you mentioned the loss of 3 billion animals, so I can imagine what that does to the biodiversity. I know there are unique animals in flora and fauna in that continent. Okay, so let us now move on to our final speaker. Last but not least is Professor Dr. Sofia Mubarika Haryana. She is from the Faculty of Medicine, Universitas Gadjah Mada, Indonesia. And she is the Professor of Histology and Cell Biology. Professor Sofia is a member of the Indonesian Academy of Sciences and Center for Bioethics and Medical Humanities. She is also the UJM UNESCO Chair on Bioethics for Indonesia and the Asia Pacific. Research interests include cancer genomics, epigenetic, cancer, and NCD biomarkers, and regenerative medicine. So welcome, Dr. Sofia, and please present to us your input from Indonesia. Over to you.
Thank you so much, Professor Jamal. Sorry. Very good afternoon, everybody. maybe I'm not the one that not expert in this climate change, but I'm preparing this presentation with team from public health and who's dealing with climate change in our university. So the issue that I should raise is about questions in this 5 minutes about Jakarta will be submerged in year 2050 because Indonesia has the low-lying many island and coastal areas. So this is a start with picture from mosque in North Jakarta that's sinking, and this has become the silent witness because of Jakarta sinking that has been started several years ago. So is Jakarta will submerge? This is the pictures that taken from satellite observation from time to time, showing that Jakarta in 2012 submerged about 18-19%, and then in 25 increase become almost 27%, and in 2050 predicted will be sinking about 35.6%. But in 2100, it will be about 52%. Study has shown that this quicken sinking because of the excessive groundwater extraction because Jakarta is the capital and the biggest city in Indonesia, has residents about 10 million, and they use well for their own usage, household. And also there are big rivers. So there are alluvial sedimentation from the rivers that end at the north part of the Java Islands. And of course, sea level increase. And this is doubled because high rainfall and flood because of climate change, and also massive building of hotels and high-rise buildings in Jakarta. I said that it's not only Jakarta actually. So the red map, this is Java Island. The red map here is Jakarta, but the red one over here is the north coast of Java Island. That there also will be submerged, and it has shown that land subsidence increased very quickly from 6.7 centimeter per year, become 10 centimeter per year from 2019 to year 20. And then also sea level increased double. And we also, thank you that before information regarding hydrometeorological disaster from Professor Abdullah, indeed that Indonesia have more than 78% disaster are hydrometeorological. And Indonesia is the third in the world most significant incidence of floods, and top 2 on disaster events. So about 278 events with top 10 deaths. So 48.6 deaths per million. And in addition to that, there is a burden of huge trust that flow to the Bay of Jakarta. This is the real situation, the condition of Jakarta. Of course, there is an effort that should be taken for this kind of situation. So there is interministerial collaboration to use a policy. They make a policy, and then the local government do the action. Indonesia is a decentralized. They have decentralized policy. It means that the policy from the central government will be conducted, but it's very much depend on the local government. So to adapt it, to increase the policy is to increase Jakarta resilience by building a giant seawalls, and also by build the artificial island in north of Jakarta. This is for Jakarta. And then for North Coastal Java, there is integrated North Coastal Java management that manage the river and the space of the community and also resettlement. And also there is a seawall in North Coastal Java in Pekalongan. So the adaptation have been taken, all of convergence to reduce the disaster risk, to make a sustainable development, and also climate change adaptation measurable. This is to show that there are 8 ministerial collaboration together in facing the disasters that come to our country, and this ministerial coordination we supported to facilitate for the collaborative of all of the stakeholders by the president as a presidential regulation number 87 2020. This is the Indonesian Grand Plan for Disaster Management. So this interministerial coordination then used by the provincial and district, because they are again decentralized policy, they will develop their management for the disaster. And this is to respond to COP26, the United Nations Climate Change Conference on Glasgow, on health program. So we have this activity, National Disaster Management Agency. Under this agency, there are a collaboration of this ministry. So what adaptation and mitigation co-benefit, especially for Jakarta? Because the reason for the empty ground because of excessive water extraction, so the municipality make the regulation to limit and ban excessive groundwater extraction. And also there are 5 big rivers that should be maintained, should be normalized, should be naturalized, and then should be managed. So there are macro ecosystem management of the river basin. And then also there are many dams that revitalize. They build revitalized dam and also build groundwater reservoir. So raining water was kept in the water reservoir to be used to the community, because at the moment there is no running water available for the community. And then also pre-review planning policy and unnecessary infrastructure projects. In a collaboration with the Netherlands, the government built grid seawall or ponder or dike in north of the Jakarta. Now for the mitigation and co-benefit, Indonesia right now develop or build green renewable energies very massively. But especially for Jakarta, they already have this electric train for inter-Jakarta, intercity, electric city of buses, and then electric cars using nickel batteries in several cities, not only in Jakarta. Also start to use in the hospital and also in the health center, paperless healthcare system. So green healthcare and telemedicine. And also mangrove has been destroyed more than 80%, and now mangrove revegetation. And also a bicycle track has been built in Jakarta, so they also used as a part of the healthy lifestyle, and also sustainable nutrition for women and baby for using their diet. And since year 2022, the President Jokowi also launched about Green Industrial Park that is the biggest. It will be the biggest park, hopefully, in Southeast Asia, and it will give push as a green support the green energy. And also our government developed hydroelectric powers, not only in Jakarta and surroundings, but also in every islands, include in the drought area, in the area of Nusa Tenggara Timur, and there are more than 1,200 hydroelectric power will now ongoing and will be developed. And this is the mitigation and co-benefit that will be not only for hydroelectric power, but also they will give a lot of benefit for the recreation and also for the farming agriculture and also aquaculture. But again, because of this decentralization, the policy has not been effective to stop the overuse of groundwater extraction. This is the problem because decentralization. So the policy from the central government will be executed at the local government. So this is the sometimes difficulties that we face. So what we need is that, of course, we need to have strong leadership at the local government to execute the policy. And also we need to have a comprehensive ecosystem restoration and then pentahelix collaboration between central government and local institutions, academicians, community, industrial, and also social media, but also again, international collaboration for sustainable education and research, and also mentioned by Professor Jamal that we need this global impact, need global effort, and then learn from each other. Thank you very much. Terima kasih.
Thank you very much, Professor Sophia. I think we all know that one positive thing or one advantage Indonesia has is that it has been up against natural hazard for as long as we can remember. You know? I mean, I'm talking about geological hazard because you are on the Pacific Rim of Fires. So you have been up against volcano and earthquake, yeah? And now you are up against the new threat from climate change. So, you know, you have this National Disaster Management Agency. We had ours just quite recently after 2014, but you have been doing this for quite some time now. Okay, so we have listened to all the 4 panelists, and now we will move into the discussion session. Mr. Hazman, can you remind me of the time that we have? I know we started a bit late, so it's we still have half an hour for the discussion.
Yes.
We do, yeah? Okay, okay, that's good. Okay, let me now throw a few questions and comment to our panelists. We have seen that how science, good science, has assisted the global community, not just the scientists, but also managed to convince our policymakers through the IPCC, through the COP, Conference of Parties, which has really brought to light the reality of climate change. I know there were skeptics in the beginning, but I think we are all on the same page right now. Yeah? Now that climate change is imminent, you know, how do we make use of science in trying to mitigate and to adapt to the changing climate, to the changing world that we may be facing in decades to come? Yeah. Anybody want to take a try at that?
Yeah, I can share.
Okay.
Yeah.
Please.
Thank you. So I think science has a very important role to play, and even though we club science as one category, it has got multiple disciplines which can contribute through various means and ways to this huge issue of climate change adaptation and mitigation, starting from monitoring and assessing how the climate change is evolving itself and what
It's
kind
2
of,
o'clock.
sorry, it's my, so how the climate change is evolving itself as well as its impact. And apart from that, it is also play important role in exposing the new knowledge and integrating how the new knowledge to existing plans and policies, because they are based on what we already know, but then climate change has just started to show different kind of impact, and the intensity and magnitude both are going to, increase further in future. Besides it, also science is very useful in its application of the new policy plans and the knowledge itself at the ground level. And I think not just physical sciences, but also the social sciences and how the local knowledge can also be integrated to scientific knowledge. That is also an area where science can play an important role. I would invite other panelists also to contribute to that, but that's what I think. So I think there are so many ways science can contribute.
Yeah, thank you very much. Please also welcome Professor Sir Dr. Andy Haynes. He has joined us on the panel to also contribute to our discussion this afternoon. Let me move on to the next issue, next question. Recently, we had the COP26 in Glasgow, which I think is a very important event, because we need to take stock and to relook at the platform that we are at in terms of climate change. And one of the major decisions made was on the agreement to phase down unabated coal power use, and to phase out inefficient fossil fuel subsidy. Now, I think this is a very important issue to the developing countries, including Malaysia, because for Malaysia, for example, we still have a heavy reliance on coal for our electricity generation. And diesel, for example, is highly subsidized energy that are being used by our farmers and our fishermen. So I think this will provide a challenge to developing countries to kick away the habit of reliance on fossil fuel. But of course, there will be good result coming out of it. So how do you think the developing countries will react to this major shift in the decision on fossil fuel? Anybody would like to take that one? Tony, will you? Oh, yeah, okay. I see Professor Sophia raised her hand. Yeah, please.
Thank you very much, Prof. Jamal.
Yeah.
I think we agree that we should making down the fossil, the ticket phase out and efficient fossil fuel subsidy, especially of course Indonesia is also use a lot, but recently best practices and lessons learned from Indonesia government that right now revitalize dams and river that are developed into hydroelectric power that will massively replace the energy power that come from fossil, and also maybe later on coal. We are still using coal as well. And we now develop, as I mentioned before, we develop more than 65 dams and river, and more than 1,214 hydroelectric power in all over Indonesia. And it has started several years ago. And hopefully this hydropower will also benefit for the irrigation of rice field and then also local tourism, and also aquaculture that will invite economics. Not only that, but also in addition that, it will invite economics to respond to this idea. Thank you.
You know, from your this geological formation, you know, is geothermal energy being exploited in any part of Indonesia? Because of the heat from, you know, geothermal power, you know. It's not widely used, but I've heard of some areas in countries in Europe.
There are geothermal, but we also have, but so far that more prominent right now is the hydroelectric power. But of course, geothermal is also one, because Indonesia has a ring of fire, and there are so many hydrothermal available. But the focus so far that I know is from the hydroelectric power. But of course, maybe this hydrothermal will also give contribution in this economical response for this power phase out of this fossil subsidy. Yeah.
Thank you. Yeah, I know Indonesia is a major exporter of coal, right? Yeah. So anybody else would like to add to that? I mean, how can we assist? Yeah, Tony, yeah, you can assist the developing countries.
Yeah, no, thanks very much, Jamal. I mean, one of the things that we're finding, of course, with energy now is that the cost of renewable energy is decreasing very rapidly. So from the point of view of developing economies, renewable energy will be increasingly important. And as we're here today focusing on human health and climate change, then I think, Jamal, in your question, you also mentioned co-benefits. So with the transition from, for example, coal-fired energy to renewable energy, we'll see significant health gains as a result of that across Asia, for example. And at the moment, every year, our air pollution around the world, quite a bit of it in large cities in countries like India and elsewhere in Asia, more than 7 million premature deaths per annum from air pollution. And so these are big numbers. To put it in perspective, at this point in the pandemic, we've seen about 6 million deaths counted. Now, these are very different situations, but it gives you a sense of scale. So these important co-benefits for health from a rapid transition to renewable energy will see health improvements across Asia.
Yeah, thank you. Thank you very much, Tony. Okay. I would like to pose another question for the panelists. Now, as climate change and its impact are imminent in many parts of the world, I don't foresee any parts of the world that can escape the impact of climate change, with obviously devastating consequences for the developing countries, especially the Pacific Island. Do you think the world is prepared to adapt to the increasing frequency and severity of heat wave, drought, floods, sea level rise? We've heard from Tony earlier about the severe bushfires, yeah, and drought and heat wave in Australia, and you're talking about a developed country, you know, you are also trying to cope with this. So I'm very worried for the rest of the world, the countries in Asia and the Pacific Island. Too bad we don't have Dr. Nasir here to say a few things about the Pacific Island. How do we work together? How do we overcome this as a global community? Yeah. Anybody? Andy, you would like to say a few words on that?
Sure. Well, I think the answer is that it's very variable, our capacity to adapt. It varies depending on the impact we're talking about, and of course in the location as well. Different parts of the world experiencing very different challenges. So we do know that some adaptation strategies are likely to be beneficial. For example, heat wave early warning systems, disaster early warning systems, infectious disease early warning systems are all likely to be beneficial, obviously where we have well-functioning health systems and emergency response systems. But for other impacts, it's much more difficult to adapt. So extreme heat, for example, we're doing some work in West Africa at the moment with pregnant women subsistence farmers. Well, they are exposed to extraordinary levels of heat, which are adversely affecting their health and the effect of their unborn child as we speak now. And it's quite difficult to see how some of these populations could adapt to increasing heat stress. And likewise, in high-income countries, we've seen these effects of wildfires. And again, you can put filters, you can have air purifiers in houses, but it's really difficult to see how you can adapt fully to these extensive wildfires that are going to get worse in the future. So that's why mitigation, cutting emissions, is so important. We have to adapt and we have to mitigate, but in mitigating, we can, as Tony has pointed out, enjoy big co-benefits, not just from improved air pollution, but also more sustainable food systems, healthier diets, more sustainable transport systems, and so on. And these benefits are near term, so they're in addition to the risk, reducing the risks of dangerous climate change over coming decades. So there is a positive side to this, but there's a lot of work to be done.
Yeah. Do you think post COP26 there will be more financial assistance and funding coming from the developed countries? I know, even during this pandemic, even the developed countries are facing financial strain, but do you think we will see more funding and financial aid from the developed country to the developing countries?
Well, one of the great disappointments, of course, has been that, in Paris, $100 billion a year were promised for climate action, adaptation and mitigation. And I'm afraid we've seen really a failure by many high-income countries to live up to their responsibilities. And currently, the funding is, last time I looked, it's about 80 billion, something of that order. Well, it sounds like a lot of money. Yeah. But actually, in global terms, when we're talking about an economy, of 100 trillion, that sort of money should be fairly easily accumulated and put into the pot by high-income countries. So that's a tremendous disappointment, I think, and reflects really a failure of commitment of the high-income countries. We have to keep pushing forward and making the argument that these funds have to be realized. They're not tremendously large when you consider the historical responsibilities of high-income countries who benefited, frankly, from fossil fuel-intensive economies. So it is only a matter of climate justice that increased funds are put in. Whether that's going to happen, I think it will happen gradually over time, but sadly not at the pace and the scale that we need to see.
I think it's similar with COVID. Nobody is safe until everybody is safe. The same thing with climate change. Okay, I want to pose the last question to the panelists. Maybe we give opportunity for Professor Robin Fierce to address this. While we are battling climate change and working hard on it, we were saddled with the issue of the pandemic, COVID-19. Of course, we have seen some positive outcome because of the slowdown in the economy in terms of carbon emission, less air travel, less people work from home and all that. But of course, because of that, we have economic impact that's equally devastating as opposed to reduction in carbon emission. Now, so what we know that impact on the economy will have positive impact on carbon emission, but we need to balance the two. We need to have economic growth and we need to have carbon emission at the same time. So how do you see the lesson learned from this pandemic experience, and this positive impact on carbon emission in terms of striking a balance between what we call life and livelihood. Yeah, we have to protect human life, but at the same time, people need to go to work. Yeah? They need to earn an income, so that means energy use and so on, and that will also mean more carbon emission. So maybe some experience from the European continent on this matter.
So thank you. You're right that there are multiple intersections between climate change and COVID-19. They can be regarded as converging health crises, but both exert extra pressures on health systems and affect the most vulnerable in society. So there's some common features, and they do interact by compounding the effects of each other in a number of regards. For example, effects of climate change on flooding and migration in the last couple of years have in some cases impaired the response of health services to COVID, and equally the indirect effect of COVID on food systems, and there have been multiple impacts around the world, may increase the vulnerability to climate change and nutritional deficiency for low-income groups. So they interact, but there's also, of course, a possibility in the future that because of the impact of climate change on ecosystems, new pathogens may arise to challenge us. And also, very importantly, one other interaction, that there is accumulating evidence that air pollution, because it increases respiratory and cardiovascular disease, worsens the effect of COVID around the world. Okay, to come to the other point, that there are indeed lessons to be learned from the response to COVID that can be applied in responding to climate change. For example, the need for global coordination, fast mobilization of resources, focus on the most vulnerable, and so on. And as you say, there's also an opportunity now to plan for the sustainable economic recovery after COVID. And that requires pursuit of additional objectives for health, for equity, environmental sustainability, as well as economic recovery. Now, many governments in Europe and around the world have promised to incorporate this as a green recovery and sustainable objectives. But in practice, over the last few months, these promises have, in a number of countries, been rather neglected, and the green recovery after COVID that was promised does not seem to be appearing in a number of countries, and the UNEP reported on that a few months ago. It's still needed, and the scientific community, I think, has a responsibility to hold policymakers to account and to ensure they do keep their promises. Analogous to promises that were previously made to fund climate change mitigation and adaptation. Thank you.
Yeah, okay. I think during the presentation, somebody brought up the issue of mental health. So I want to address a question from Dr. Perwais Iqbal from Pakistan. His comment that mental health issue arising from climate change is a major challenge in Pakistan. And he believes that the situation is the same in other countries. Now, he would like to know what kind of mitigation strategies could be adopted to address this problem. And I think this mental health issue is not just unique to climate change. In terms of COVID-19, we are seeing a lot of mental health impact as well. Yeah. Anybody would like to try and answer that question? It's open to anyone. Yeah. Tony, okay. Tony and then Andy. Oh, wait,
Yeah.
wait, Tony. Yeah, okay. Can I, because there's another question specific for you.
Okay, why don't we go to Andy
I will let
first on this
Tony
one.
have a go on this one. And then the next one, you will answer that one and also come back to this. question.
Yeah.
Is that
Yeah,
okay?
so Andy, go on this one, and
Okay.
I'll do the next one.
Yeah.
Well, thanks. Yeah, this is a really important and difficult question to answer. So there are a number of health impacts of climate change. One, of course, is the effects of natural increased disasters, wildfires, heat, and so on mental health. And we do know that after an extreme event, mental health problems, common mental disorders, can be persistent for quite long periods after the event. So they reflect the fact that people's livelihoods have been destroyed, that their local environment has been damaged, and maybe their physical health has been affected as well. There's also emerging concepts like solastalgia. Solastalgia is the kind of grief that's been called the grief related to environmental change, where communities see their environment changing and they can't reconstitute their original environment. So there's a form of grief in losing those familiar environments. And then, of course, there's the whole phenomenon of climate anxiety. Now, climate anxiety is being recorded in many, many countries as being very common, particularly amongst young people. And you can see this, I think, not as necessarily a pathology, but a very reasonable feeling of anxiety in the face of an uncertain future. Mm-hmm. So all these are worrying trends. But I suppose on a more positive response would be that we need to improve the management of common mental disorders at the level of the primary care, in healthcare systems, at mental health services, but also more community resilience. So we know that communities can support each other. And we also need to acknowledge that there's potential co-benefits of climate action. Some colleagues have been suggesting that by getting more engaged in climate action, whether that be adaptation or mitigation, this can help to reduce the feelings of helplessness and climate anxiety that, of course, many of us feel from time to time when we see the situation not being addressed as quickly as we'd like to see. So it is a concerning field. A lot more research is needed. But again, there could be positive spin-offs from action.
Yeah. So we not only should talk about adaptation to the changing environment, but also the adaptation to the mental state that people are being pushed into, right? Okay, Tony, this one question is specifically addressed to you from Johanna of IAP, but you can also answer the question on mental health as well. Yeah? Do you feel that your work in Australia has led to any significant policy responses? If not, what do you think could be done to get this topic higher on the policymakers' agenda?
Thanks, Joanna. There's a really important question. And I think the first thing that I would say in response to this, when we're talking about science and in the context of human health and climate change, is that from an Australian point of view, we were very fortunate that Tony McMichael was a leader in this field, among the first, with Andy Haynes and others, to explore relationships between climate change and health decades ago now. So Australia has been in a fortunate position to have relatively good capability around the science of climate change and health. That said, as Joanna points out, frankly, Australia is a Luddite in action on climate change. So there's a disconnect here. I think, in fact, in the Lancet at one stage, there was a short piece saying that Australia was leading on health and climate change science, but Australia was failing on action on climate change. And I think it's a good point to make. Certainly one thing that is helping in Australia, and I think our colleague from India was mentioning the importance of civil society. Shabana, I think you referred to this. And in Australia, we do have an active Climate and Health Alliance, which is like an advocacy organisation that researchers work closely with, and they get into the offices of the politicians. But it's clear that our democratic institutions aren't working. that the fossil fuel industry in Australia has undue influence in our parliament. So that's the nub of the challenge. In the institute that I directed, Monash, we now work directly with industry, identifying pathways to decarbonisation in key sectors like the energy sector, for example. And some of you may have seen in the media that one of the wealthiest Australians has actually put a proposal with partners to purchase our biggest energy company in Australia called AGL, which supplies energy to a quarter of Australian households. He's proposing to buy that company to more rapidly decarbonise it. So I think these are the kinds of things, scientists working directly with industry, and then the politicians coming along behind in that journey. There's certainly in our country, our elected officials aren't leading at the moment. So I hope that's a helpful intervention. Thank you, Joanna.
Yeah, that's an interesting development in terms of the economy of renewable energy. You know, it used to be on the back burner, but now you can see, industries and the corporate sector banking on renewable energy. So hopefully, they will find incentive to move from traditional fossil fuel to renewable energy. Okay, Mr. Hazman, how are we doing on time? I have a lot of questions here from the audience. I think we won't be able to answer all, but I just want to know in terms of time, how much time do we have left?
I think we can have another 5 minutes.
5 minutes, huh? Okay. Yeah, there's an interesting question from somebody, from Muhammad Arshad. I'm not sure from where. He wants to know how can we include climate change impact in One Health approach. I think that's another important development or important perspective of health. The interaction between animal and man in One Health, and many believe that climate change has consequences or impact on the development of One Health related issues. Yeah? What do you think? How can we tackle both of these together rather than in piecemeal? I see somebody. Robin.
If I could maybe start off, the One Health implications are important, and certainly we see in Europe effects of climate change on animal health, animal infections in livestock, and so on, and a number of responses are underway to tackle that in terms of adapting to the impacts on livestock. But of course, there is another side to all this, that livestock themselves are an important contributor to greenhouse gases and climate change. So really, the policy objective for us all is to ensure within the One Health context that we can promote animal health and in agriculture and animal productivity and welfare, while at the same time reducing where we can the contribution of animals in farming to greenhouse gas emissions. There are, I think, scientific opportunities that will help to decouple livestock productivity from greenhouse gas emissions, and these initiatives are underway in various parts of the world, building on variously the genetics of livestock themselves, their microbiome, the genetics of feedstock to reduce methane production, for example. So we know a lot about the problems, but we do need to do more to within the One Health context to tackle
Yes.
the challenges of both climate resilient agriculture and greenhouse gas emissions and mitigating them from the agricultural sector.
Yeah, indeed, we are moving into some uncharted territory, moving forward, with One Health issue, climate change, the pandemic. But I think I'm confident with humanity and the scientific community, we will find a solution. Tony, you raised a hand. Yeah, Tony, you want to say something? You are muted.
Oh, sorry. I think that might have been a legacy hand.
Oh, okay.
I wasn't raising
Oh,
again.
okay.
Prof. Sophia actually raised her hand. Sorry,
Yeah.
Prof.
Yes. Before that, Professor Sophia, I want to highlight one more question, which I think came from somebody in Indonesia. Yodi. Oh, no. Okay. No, maybe not. Maybe not from Indonesia. But anyway, he or she wants to know the focus on the upcoming Science 20 joint statement as part of the G20 presidency of Indonesia is on climate change and health. I think Indonesia just joined the G20 group, right? So science may exacerbate the problem of global health. What can policy adopt a more natural and pristine way of life to solve the global problem? So she's talking about this G20 presidency of Indonesia leading the G20 group. What can Indonesia bring to the table? And you can also answer the question that was raised before. Yeah, please, the floor is yours. Professor Sophia.
Thank you very much, Professor Jamal. First, I would like to respond about One Health. So I think that climate change cause many kind of disaster or destroy things, forest fire that make the biodiversity become imbalance, and then this biodiversity cause the ecosystem between human being, animal, and environment imbalance. So that's why One Health, I think, become very important. It's one of the things that we should also tackle. Climate change and ecosystem should be in balance to make it the balance between the community. So this is a multidisciplinary approach, not only from health, but also from veterinary, from social, from agriculture, from engineering. It should work together, hand in hand, to tackle this imbalance. And then secondly, from the G20, indeed that actually we are facing not only climate change on health, but also global health because of pandemic. So we have the how to tackle this pandemic, and because the pandemic will exacerbate the global health, and I think we should work together, because we also already mentioned about high income country and low middle income country and low income country. So we should work together, because inequity and disequity, and we know that the low middle income country and low income country is the most affected of this global health. So therefore we have to work together, and there is a kind of moral obligation. If we learn about Universal Declaration of UNESCO, that we have to have solidarity and international cooperation. So this is the time for us to work together to make the equity between high-income country and low-middle-income country in terms of technology, in terms of infrastructure, expertise, and also capability and preparedness in facing the next pandemic or the next global that will face all of us. Thank you very much.
Thank you very much. Before we end, Dr. Shabana, would you like to add anything to the discussion that we just had?
I think I totally agree with what Professor Sophia said, and I think just want to I can re-emphasize the importance of One Health approach, because I think that is very essential and it's complementary with what we are wanting to achieve through climate change mitigation and adaptation as well. So that's it. So I think Professor Victor also wanted to say, so he raised hands.
Victor, you want to
No. Thank you very much. I think it's been a very interesting discussion happening here. I think there's a lot more we can do. Thank you, Dr. Shabana.
Yeah. Okay. I think we are up again time. So I will like to take this opportunity to thank everyone who has participated in the discussion. Obviously, we have only touched the surface and maybe the tip of the iceberg in terms of the issue of climate change and health. The more we discuss, the more we realize that there are areas that we need to cover and to quickly bring up to speed in terms of knowledge and information. I would like to thank everyone for a very interesting discussion, and also to congratulate AASSA and Academy of Sciences Malaysia for hosting this webinar. And I believe the audience has also benefited from your deliberation. And I hope this discussion will obviously continue into the future because we will be facing more challenges and more issues in the coming years. Okay, thank you very much, everyone. And I'll pass back the floor to Mr. Hazman. Thank you.
All right. Thank you so much, Prof. Jamal, and all the panelists for the amazing and insightful session. So our next speaker needs no further introduction. Professor Sir Andy Hines is one of the experts in climate change and planetary health. He was a member of the IPCC and currently co-chairs the IAP Working Group on Climate Change and Health. For all his impressive work and contribution, Prof. Hines was awarded the Tyler Prize for Environmental Achievement in 2022. Without further ado, I would like to invite Prof. Hines to give his welcome remarks, his closing remarks for our webinar. Thank you, Prof.
Well, thank you so much, Hazman, for the kind introduction. And can I start really by congratulating all those who presented here today. I think it's been a really excellent session and we've covered a lot of ground. I'd like to particularly congratulate the colleagues on AASSA for the very intensive and thorough report on climate change and health in the Asia region. And I've no doubt that it will have an enduring impact on the whole discourse and discussion around climate change and health. So let me finish because we're running out of time. In fact, we've run out of time, but very few quick remarks. I think the old model of science, where most of us were trained in a kind of single disciplinary approach, where we're trained in different silos, whether it's epidemiology or, medical statistics or social sciences or whatever it was. And, these single disciplinary approaches will not work with these complex problems that we're now confronted with. So we need to work across disciplines, the idea of transdisciplinarity, where all relevant disciplines are involved at the outset of defining a particular problem and researching potential solutions. So we need to break free of our rather narrow disciplinary perspectives. And also it's very clear that a single sector cannot make the necessary changes that are required to set us on the right path for a zero carbon economy that will secure our health and well-being in the future. So we need to engage a range of different sectors, energy, transport, food and agriculture, housing, and of course the healthcare sector itself. So we need to reach out beyond our kind of traditional limits of public health. And we're dealing here with complex systems. So these are not necessarily linear relationships. When we perturb a particular system, it can change in all sorts of unpredictable ways. You can get positive and negative feedbacks, which can result in sudden changes in the environment, which can be very bad for health. And so we need to include this complex systems approach when we're trying to think about how to understand the impacts of climate change on health and how to develop evidence-based solutions. We talked quite generally about the effects of climate change on health, but I wanted to emphasize that increasingly we can actually attribute particular climatic events to climate change. So in the past, we would talk just about generically about the effects of extreme heat on health. We can now say that this particular heat wave was unlikely to take place in the absence of climate change. So a recent paper, for example, from some of my colleagues has shown that over a third of the heat-related deaths over the last 3 decades can be attributed to human-induced climate change. They're not due to natural variations in temperature. So that's a real step forward, a step change, I think, in the science of climate change impacts. We've also heard today that it's not just physical health, it's mental health, which is also increasingly becoming a research priority. But as well as documenting the effects of climate change on health, we also, as we've heard repeatedly today, need to ensure that we act, and we act quickly. And there are these 2 types of actions, adaptation and mitigation. Again, they've tended to be rather separate. Increasingly, we need to integrate adaptation and mitigation if we're to reduce the health effects of climate change. And although the health effects of climate change are very worrying and they're negative, there is much that can be done. So let me end on a positive note and say that the healthcare benefits of climate action, as we've heard from Tony Capon, from reduced air pollution, for example, as a result of the use of clean renewable energy, more sustainable transport systems with more public transport, walking and cycling, less dependence on the private car, more sustainable food systems, emphasizing low environmental impact dietary choices, more plant-based foods and so on, particularly in those cultures that consume large amounts of red meat, then that can be beneficial to our health and beneficial for the climate. So in summary, there are major challenges ahead, and we are certainly not going to achieve the 1.5 degree centigrade target that was outlined in the Paris Agreement, very sadly. However, with action, we can still keep well below 2 degrees, and we have to push forward with that in mind. Health has been very much at the sidelines of the climate change debate until now, but it is becoming now towards the foreground. And I think it's important for all of us to ensure that in our nationally determined contributions that our governments put forward under the Paris Agreement, that health is a prominent player, not just the impacts of climate change on health, but also the benefits of climate action, both adaptation and mitigation. Thank you very much indeed, and congratulations to all of you.
Thank you so much, Prof. Hines, for the wonderful closing remarks. With that, ladies and gentlemen, we have come to the end of our webinar. But before we end, I would like to invite all our panelists and moderator to open your camera for our photo session. All right. Smile, 3, 2, 1. Another one, 3, 2, 1. All right, thank you. I hope all the attendees enjoyed the session, and I also hope the webinar has been beneficial to all of you, and may this be an avenue for us to make a significant change. Please keep an eye for more updates on the next webinar for this series. Thank you, everyone. Stay safe and stay healthy. Goodbye.
Take care.